With COVID cases surging, how will Indiana respond? We'll hear from Governor Eric Holcomb on the rising case numbers and the president's executive order on evictions. Plus, Indy Mayor Joe Hogsett and state representatives on both sides of the aisle discuss the looming redistricting fight at the State House. It's all ahead this Sunday in Focus.
Good morning. I'm Dan Spieler. The state of Indiana continuing to see sharp new increases when it comes to cases of COVID-19 and hospitalizations, with some local communities and school districts now taking further action to limit the spread of the virus. But what about this new variant? How much of a danger does it pose to our children? Lindsay Stone spoke with some local experts this week.
We're definitely seeing a trend in increased both cases and hospitalizations among youth.
Experts say children are the most impacted by the spread of the Delta variant right now.
We've gone from sort of an average of about 1 hospitalization a day for people under 18 to now about 2 per day. So it's kind of jumped up here in the last couple of weeks.
Nurses inside Riley Children's Hospital tell me their patient load has nearly doubled in the last month.
The hospital has been packed full, in the last few weeks.
Dr. John Christensen is a pediatric infectious disease specialist who treats the youngest Hoosiers battling COVID-19.
No question that when you look at the numbers from the past few days, they're significantly higher than what we saw in let's say January.
In just the last 3 days, 21 children have tested positive for COVID at Riley. Compare that to January, before vaccination started, and the hospital had 30 positive cases over a 2-week period. Experts say some of the surge in cases among children can be attributed to the return of large gatherings and mask mandates ending.
What has happened is that, as a society, we let down our guard earlier this summer.
Data collected by the Regenstrief Institute found the majority of children coming into the emergency room are unvaccinated, some because they're too young, others because their parents didn't want them to get the vaccine.
I think what we'll see this year is that hospital rates will go up over the next several weeks as cases continue to climb, but we're probably not facing sort of, overcapacity issues like what we saw last year.
In Indianapolis, Lindsay Stone, Fox 59 News.
Lindsay, thanks. This week we also heard from Governor Eric Holcomb and from the Indiana Chamber as private businesses now deal with the threat from this variant. What will it mean for Indiana employers? Should they be considering more vaccine requirements? Our Kristen Eskow leads our coverage today from the State House.
More businesses are mandating masks regardless of vaccination status, and a few businesses in Indiana are mandating the vaccine for employees. This week I asked the Indiana Chamber of Commerce their position on that and their recommendations for businesses.
At this downtown Indy boutique, the sign by the front door tells fully vaccinated customers they don't need to wear a mask. Starting next week, the owner says that will change.
It's a lot of up and down and a lot of trying to decide what's best for the biggest amount of people while not alienating customers, but keeping employees safe.
Amanda Maurer-Taflinger says even though her employees at Homespun Modern Handmade have all been vaccinated by choice, she'll require them and all customers to wear a mask.
Cases are going back up again, and we just don't have a lot of other choice right now.
The Indiana Chamber of Commerce says more businesses are reinstating mask mandates, and a few have vaccine mandates for employees right now. Most of those are in the healthcare field. Officials say that could be changing as more businesses are considering requiring vaccines.
If this persists, then it's likely that will be considered by more and more employers.
In the meantime, Kevin Brinegar says he's urging business owners to encourage their employees to get vaccinated.
We've helped facilitate many employers serving as vaccination sites or organizing groups of employees to go to a vaccination site.
Governor Eric Holcomb told me he's not against private employers mandating the vaccine for their workers.
Private businesses have to figure out a way to most safely conduct their business.
The governor also spoke about the extended eviction moratorium, and I asked him about the rising COVID-19 case numbers we're seeing here in Indiana.
Fortunately, in the state of Indiana, we have the funding and we have the resources. Now, people do have to take the initiative to apply for that, but some of the money, there's 2 different buckets of money. There's money that was sent directly to the bigger metropolitan areas in our state, and then there was money sent to the state. If the local communities' funds are depleted, the state has the funding available to replenish.
We heard some recommendations from the health department last week, but are you considering any statewide restrictions?
No, I'm considering just what I've shared, and at this point, you know, we mentioned that last year we spent about $3 billion. We spent about $300 million just on the testing and the tracing and the vaccination access. We watch the rates, the hospitalization rates on more than a daily basis, and we'll continue to make sure that we have the resources that are available, and that will guide our decisions, quite frankly. I hope those numbers will encourage more people to do what the millions of us that have been vaccinated have done. And that's not to say that it'll, you know, be 100% guaranteed you'll never get it, but you know, you can read the numbers and see that 99+%, if they do, they're not being hospitalized, and surely they're not dying. So that's the true and surest way that we all get, not just through this, but out of it.
Governor Holcomb also took questions about the redistricting process now getting underway. I spoke with him and state lawmakers on both sides of the aisle. The number of congressional representatives and state lawmakers will stay the same in Indiana, but their districts will soon look somewhat different.
I would expect districts around Marion County to contract in size geographically, and districts outside of central Indiana are going to need to expand.
State Representative Timothy Wesco, who chairs the House Elections Committee, says state lawmakers are hosting 9 public input meetings across Indiana before the maps are drawn.
We as the legislature have constitutional and statutory obligations that we are going to follow to the letter of the law.
Wesco says the process will be fair, but not everyone feels that way.
It's just important to realize that we have this kind of parallel process where we have the public relations campaign and we have what's really happening behind closed doors. So it's important that the public demand that they be let into what's happening behind closed doors.
Democrats like State Representative Matt Pierce, who's also on the House committee that works on redistricting, are worried about gerrymandering.
It's likely that the Republican majority will use this as an opportunity to seal in, again, their supermajority and draw the boundaries in a way that gives them an advantage.
I asked Governor Eric Holcomb about those concerns. He maintains the process will be conducted fairly and legally.
I'm confident that we'll have a transparent, open, public welcome, input welcome, and the process will be fair. And again, I won't say anything that's not constitutional.
Another public meeting is set for Wednesday in Indianapolis. Now, state lawmakers tell me there will be another opportunity for the public to give input on the maps after they're drawn. That would happen at the Senate and House Elections Committees in September regarding redistricting.